For this week's Journal Club, I chose to present the article Vitamin B12 Among Vegetarians Status, Assessment, and Supplementation. I chose this article because of the recent popularity of vegan and vegetarian diets. Many of my friends have taken up these diets for a variety of reasons, and I am constantly hearing about the benefits. There are also a number of documentaries out that preach the benefits of going plant based. The dangers of B12 deficiency in a plant based diet is something I have briefly read about, which provoked me to choose this article. This article was written to assess whether the vegetarian diet was suitable for the population. Vegetarianism and veganism have gained a lot of popularity throughout recent years. People choose these diets for a variety of reasons, whether environmental, ethical, or health related. There are many plant-based subcategories in the overarching category of vegetarianism. Some of these diets exclude animal meat but include egg and dairy products, while others exclude all animal products completely. Scientific literature has found that the exclusion of animal products may reduce the risk of diseases such as coronary heart disease and type 2 diabetes. Vegetarians have a reduced body mass index, lower blood pressure, and lower mortality rates when compared to non-vegetarians. Even with these proven health benefits, there is the question of whether reducing or excluding animal products from your diet is safe. The American Dietetic Association established that vegetarian diets are safe and sustainable for all age groups and populations, including athletes and during pregnancy and lactation. Even so, if the vegetarian diet is not balanced properly, there is a risk of nutritional deficiencies that could offset the benefits. An unbalanced vegetarian diet can lead to a lack of nutrients that are not adequately represented in plant-based foods, such as B12, iron, zinc, and vitamin D. This article emphasized the importance of incorporating B12 in one's diet because it is nearly absent in vegetables. B12 is also called cobalamin. The vitamin cobalamin is a water-soluble vitamin found in significant amounts only in animal products. B12 plays a key role in cell replication and in fatty acid metabolism. Not having enough B12 in an individual's diet causes a shortage of red blood cells and can lead to anemia. This can leave you feeling weak and fatigued because the individual does not have enough red blood cells to transport oxygen throughout the body. B12 also is important for neuronal health, and in severe deficiency cases can alter correct nerve transmission. The purpose of this study was to assess the status of B12 among vegetarians and discuss if supplementation of cobalamin is an adequate solution for combating deficiency. The article assessed cobalamin's absorption and transport properties to determine if supplementation was an adequate solution to combat deficiency in a plant-based diet. Although this article focuses on vegetarians, I feel it is important to note that they are not the only population at risk for vitamin B12 deficiency. Other groups are also at greater risk for vitamin B12 deficiency, such as pregnant women and the elderly population. The amount of B12 needed is greater during pregnancy and lactation due to the expansion of tissues. The elderly population is more at risk because of a natural alteration of the gastrointestinal mucus. According to the article, the use of supplements or fortified foods has been successful for preventing deficiencies in all populations. Studies have found that people often avoid supplementation due to preconceptions and ideological barriers. The author concluded that the vegetarian diet can be sustainable at all ages and stages of life. While the vegetarian diet has a variety of positive health consequences, not correctly supplementing the vitamin B12 can completely abolish these benefits. If the consumption of animal foods is very low or absent, cobalamin's inadequate presence in plant foods makes its introduction essential, either through supplements or fortified foods. Some strengths of this article were that it gave detailed information on B12 and where it comes from. The article also included ideas for future research and different vegetable sources that have B12, which I found really helpful. This article also had some limitations that I feel are important to note. To start, the author did not include ideas for overcoming ideological barriers when it comes to supplementation among this population. They also did not give an exact answer for how much B12 is sufficient for a human diet. After reading this article, it is clear that more research needs to be conducted in this area. Overall, I felt this review was very well written and informative. I have a lot of friends who stick to a strict vegetarian or vegan diet and have heard them preach about the benefits over the past couple of years. While the benefits of a vegetarian diet seem promising, there is definitely still some research that needs to be done. It is also clear that there are some ideological barriers on supplementation that need to be overcome in order to ensure that people participating in these diets are not putting themselves at risk. I think it is important that more research is done so that a consensus for supplementation among vegetarians can be made. I'm going to leave you guys with some discussion questions. First, based on what you have learned in this presentation, do you believe the benefits of a vegetarian diet outweigh the risks? Second, the article stated that while the dangers of B12 deficiency are known, supplement use is frequently resisted. What do you believe are some barriers that may deter someone from taking supplements? Do you think some people have a negative connotation when it comes to supplements? And lastly, what conceptual framework do you believe would be the most successful for changing an individual's behavior when it comes to supplementation? Thanks for listening.